Hi, and welcome to the AHIP Medicare Training Prep Course. This is Section 1. My name is Eddie Krameyer. I'm president of ABC Medicare, and we're going to help you get certified to be able to offer Medicare plans. The certification process is a two-step process. You've got to pass your AHIP class or AHIP test. You've got to make a 90%. And in this course, in these sections, we're going to cover primarily what you need to know to pass that test. And if you don't pass your test within the first 2 tries, contact our office and we'll help coach you some more individually to help you get through the test. So the first step in getting certified is to do your AHIP test, pass that, and then transmit your transcript to each of the carriers that you're contracted with to finish the certification process. So let's jump into Section 1, Original Medicare. So what is Medicare? Medicare is health insurance. Who administers Medicare? CMS, which is the Centers for Medicare and Medicaid Services. That's a department of, it's U.S. Department of Health and Human Services. Do the new Medicare cards include personal Social Security numbers? No, they absolutely don't, and we're excited they finally have fixed that. So what are the parts of Medicare? Part A, which is hospital coverage, is part of Original Medicare. Part B, which is medical coverage, that's also part of Original Medicare. And then Part C is a Medicare health plan, also known as a Medicare Advantage plan. And there are several types of Medicare Advantage plans that you'll be learning about. And then Part D, which is prescription drug coverage. Standalone drug plans are known as a PDP or a standalone prescription drug plan. And then Medigap plans, which are also known as Medicare supplement plans, those are really not a part of Medicare like the first 4 parts are, but Medigap plans or Medicare supplement plans only work with Original Medicare. So what is Original Medicare? Original Medicare is health insurance made up of Part A and Part B. Part A is hospital coverage, Part B is medical coverage. There are 2 ways to get Part A and B of Medicare if you have both Part A and B of Medicare. The first way is for somebody to get it from the government to stay on Original Medicare, or if they have both Part A and B and they meet the other qualifications, they can enroll in a Medicare health plan, also known as Part C, and get their Medicare A and B benefits from a private insurance company. That's also known as a Medicare Advantage plan or a Medicare health plan. Can a person have Original Medicare Part A only? Absolutely. And on their Medicare card, it would only show Part A. Can a person have Original Medicare Part B only? Absolutely. And that would be the very rare exception, though, because Medicare Part A generally never has a premium, but Part B does, so usually you're not going to find this case. If somebody only has one part, it's usually just going to be Part A. What is another name for Original Medicare? That is Original or Fee-for-Service Medicare. So Fee-for-Service Medicare, if you see that term, they're talking about Original Medicare. Who qualifies for Medicare? U.S. citizens or permanent residents that are age 65 or older, everyone under age 65 on Social Security disability after 24 months, and that's the key. Now, just because somebody is on disability does not mean they're going to qualify for Medicare. They have to be on Social Security disability, okay? Also, individuals with certain diseases like ESRD or end-stage renal disease can qualify for Medicare 4 months after dialysis starts. And there are certain diseases like ALS or Lou Gehrig's disease where Medicare is immediate and they can get on Social Security disability immediately if they have that particular disease. When can a person turning age 65 enroll in Parts A and B of Medicare? That's during their Medicare initial enrollment period, which begins 3 months before their 65th birthday, includes the month they turn 65, and ends 3 months after, so that's a 7-month window. the 3 months before their birth month, and then the following 3 months. So what is the earliest effective date for a Part A and B for a person turning age 65? It's generally going to be the first day of their birth month. Part A and Part B effective dates are always the first day of the month. However, if somebody is born on the first day of the month, then their Medicare can actually start the month prior to their birth month. So what's the latest possible effective date for a person enrolling in Part A and B that's turning age 65? And that would be the 4th month after their birth month, because the 7-month window would have run out, and so that's the latest that it could start. If an individual turning age 65 delays Part B enrollment, when can they enroll in Part B? Okay, that depends on, number one, if they have employer group coverage. If they have employer group coverage, they can enroll at any time in Part B of Medicare. Okay, so if they delay their Part B enrollment, they don't enroll when they turn 65. If they have group health insurance, they can enroll in Part B at any time while they have employer group health, or within 8 months of losing employer group health. A lot of agents will get this confused, so make sure you understand. If a person does not enroll in Part B when they turn 65, if they delay it, if they have employer group coverage, they can enroll in Part B at any time or within 8 months of losing employer group coverage. If a person does not have employer group coverage, the only other time they can enroll in Medicare is during the general enrollment period, which runs from January 1st to March 31st, and Part B actually doesn't start until July 1st, okay? So when a person enrolls in Part B during the Medicare general enrollment period, what will be their Part B effective date? We already said that. It's going to be July 1st. Okay? Is a person that is drawing Social Security benefits at age 65 automatically enrolled in Medicare Parts A and B? The answer is yes. They will also get a form in the mail that they can complete and return to Social Security, opting out of Part B. Is a person that is not drawing Social Security benefits at age 65 automatically enrolled in Medicare Parts A and B? The answer is no. They must take action and enroll through Social Security's website, which you can help them do, or they can go to Social Security to get enrolled in Medicare Parts A and B. How many months does a person have to draw Social Security disability benefits before they can get Medicare Parts A and B? What's the answer? We already covered that. It is 24 months. Is a person that is drawing Social Security disability benefits automatically enrolled in Medicare Parts A and B at the end of 24 months, or do they have to actively enroll? The fact is they're automatically enrolled. For a person with end-stage renal disease, ESRD, when do they qualify for Medicare Parts A and B? We already covered that. That is 4 months after starting dialysis. What is the cost or premium for Part A of Medicare? Generally, it's zero if a person paid into Medicare for 40 quarters, which is 10 years, or married to someone who did. They're going to qualify for Part A, and the premium is going to be zero. For people that did not pay in to Medicare for 40 quarters, or married to someone who did, then they're going to pay a monthly premium, which goes up every year. For 2019, it's almost $500 a month. Question: do high-income earners pay more for Medicare Part A? The answer is no. Can there be a penalty for not enrolling in Medicare Part A when first eligible? No. What is the cost or premium for Medicare Part B? Currently, for 2019, the premium is $135 a month unless people make a lot more money. Do high-income earners pay more for Medicare Part B? The answer is they may have to. Yes. Individuals with incomes over $85,000 or filing jointly with incomes over $170,000, and you don't need to know these income limits for the test. All you need to remember is high income earners may have to pay an additional Part B premium, also known as IRMA, or Income Related Monthly Adjustment Amounts. You'll find out later that IRMA applies to Part B of Medicare, and it also applies to Part D as in drug, Part D of Medicare also. Can there be a penalty for not enrolling in Medicare Part B? Absolutely yes. When is there a penalty for not enrolling in Part B? Individuals are subject to a late enrollment penalty when they do not enroll in Part B when first eligible and they go without credible health care coverage. Credible health care coverage is coverage at least as good as original Medicare Part A and B. How is the late enrollment penalty for Part B calculated? The Part B premium is increased 10% for each full 12-month period the beneficiary could have had Part B but did not enroll. So for example, somebody turns age 65, they do not enroll in Part B, and they do not have credible health care coverage, and they're now 70. So they've gone for 5 full years. They're going to pay a 50% penalty for the rest of their life, and the only way we can get that eliminated for people is if they qualify for the Medicare Savings Program, which would pay their Part B premium and the penalty also. What is credible health care coverage? We already covered that. It's coverage that's at least as good as Medicare Parts A and B. Does everyone need to enroll in Part B of Medicare? No. If they have health care coverage that's at least as good as Medicare Parts A and B, credible health care coverage, and they're going to keep it, then they don't necessarily need to enroll in Part B. But that doesn't mean they should always keep their group health insurance. That's another topic for another matter, okay? But as far as the test is concerned, they do not have to enroll in Part B. However, if their employer has 20 or fewer employees, they should absolutely enroll in Part B because Medicare will be primary and their group health insurance will be secondary. Are VA benefits considered credible health care coverage? And the answer is no. So if a veteran turns age 65, does not enroll in Part B, and that does not have group health insurance, and later wants to enroll in Part B, they're going to owe a penalty. This is something that I believe is absolutely wrong, that our government needs to get changed, okay? So VA benefits are not credible health care coverage, but you'll learn later that VA benefits are credible drug coverage, okay? So are Indian health benefits considered credible health care coverage? The answer is also no. It works basically just like VA benefits. It is not credible health care coverage, but it is credible drug coverage. Are employer group health plans considered credible health care coverage? Generally speaking, the answer is yes, unless indicated otherwise. So what is covered under original fee-for-service Medicare? Part A, which covers hospital, skilled nursing, hospice, and home health care services, and Part B, which covers professional services such as those provided by a doctor. So generally speaking, Part A covers facilities and Part B covers providers or doctors and practitioners and the such. What would a person expect to pay for a hospital stay under original Medicare? This will most likely be on your test. You don't need to know the numbers, but you need to know the periods and how it works. There's a single deductible amount due for the first 60 days of any inpatient hospital stay, after which it converts into a per day coinsurance amount up through day 90. After day 90, they would pay a daily amount up to 60 days over their lifetime. The bottom line is original Medicare will only cover, if that's all a person has, it will only cover the first 150 days in the hospital. After that time period, the Medicare beneficiary would be responsible for 100% of the charges because Medicare won't cover hospital stay after 150 days if they just have original Medicare. What would a person expect to pay under Medicare Part B? Part B primarily covers physician services. They're going to pay a monthly premium for Part B unless they qualify for the Medicare Savings Program. They're going to pay an annual deductible under Part B, and that goes up every year, and it's a one-time deductible. Then after that deductible, there's a 20% coinsurance with the exception of many preventative and screening tests. So under Part B, if a person has $100,000 of charges, they've got a small deductible, and then they're going to pay 20% of whatever's left. So if it's $100,000 in charges, they're going to owe $20,000. Does Medicare cover annual checkups? The answer is yes. Medicare will cover annual wellness even if a person has no illness or injuries, likely be on your test. Does Medicare cost related to terminal illness? Yes, Medicare covers hospice services. After a hospital stay, does Medicare cover nursing and rehabilitation care? The answer is yes. Medicare will cover skilled nursing services without a copay for the first 20 days, after which a daily copay applies until skilled nursing coverage ends at 100 days. However, under original Medicare, it will not cover skilled nursing unless a person is in the hospital, checked in as an inpatient, and spends 3 nights in a hospital as an inpatient. That won't be on your test, but it's going to be important for you to know that for lots of other reasons. Does Medicare cover cancer screening? Yes. Medicare covers periodic performance of a range of screening tests that are meant to provide early detection of disease. Specific tests will need to be checked to see if they are covered before having the test completed. Does Medicare cover inpatient psychiatric hospital stays? The answer is yes. Likely will be a test question. Medicare will cover a total of 190 days of inpatient psychiatric care over a person's entire lifetime. Does Medicare cover glasses, dentures, and acupuncture? The answer is no. Medicare does not cover acupuncture or, in general, glasses or dentures. The only time Medicare will cover glasses is after cataract surgery. But generally speaking, Medicare does not cover these items. Does Medicare cover ambulance services? Yes. Original Medicare covers ambulance services. Does original Medicare cover prescription drugs? The answer for the test is no. Part D of Medicare covers prescription drugs. Now, one of the things that you need to know, this is not on the test, but some drugs are actually covered under Part B of Medicare, and those are medicines that are usually given at a doctor's office or in a hospital, injections and things like that. But generally speaking, Medicare does not cover prescription drugs. They're only covered under Part D of Medicare. What is the max out-of-pocket or MOOP on original Medicare? So if you're not familiar with that term, max out-of-pocket is every health plan I've ever seen has a max out-of-pocket, where if your copays hit a certain amount, it might be $5,000, it might be $10,000, and if your copays hit that amount, then for the rest of the year, your plan has to pay 100% of the cost. Do you know what the max out-of-pocket is on original Medicare? The fact is there is not a max out-of-pocket on original Medicare, which is one of the primary reasons that medical bills are the primary cause of bankruptcy in this country. What are the 2 ways to get more coverage than original Medicare? Option 1 is for somebody to stay on original Medicare. and then purchase a Medigap plan, also known as a Medicare supplement plan, from a private insurance company. Or option 2 is to enroll in a Part C plan, also known as a Medicare health plan or a Medicare Advantage plan. And all of these plans include some type of extra benefits, such as dental, glasses, gym memberships, hearing aids, over-the-counter benefits, and it is on a case-by-case basis depending on the particular plan. According to the Kaiser Foundation, last year more than 19 million people chose Medicare Advantage plans. So this is the end of Section 1 on Original Medicare, of getting ready for the AHIP exam. Section 2 is coming up, and if you're partnered with us, that's free. If not, you're welcome to partner with us, and you'll have access to all the videos to help you get through the AHIP training course. God bless and have an awesome day.